Hi, my name's McGlashan and I'm one of the directors at Fitwise Physiotherapy. We often get asked, why is exercise important during pregnancy? Pregnancy is a time when your body is under a lot of extra physical stress, and as your tummy gets bigger it becomes more of an effort for you to do normal things during the day. So staying fit and staying well is really important during your pregnancy, and the exercise guidelines are the same as they are for non-pregnant people, in that for a normal healthy woman during pregnancy she should be aiming to do 30 minutes of exercise on most days of the week. We also get asked, do you have to actually modify exercise when you're pregnant? Everybody is different in terms of what they are able to do in terms of intensity of exercise when they're pregnant. But a nice reliable tool is what we call the talk test. So if you are exercising at a moderate level, which is what is recommended during pregnancy, you are still able to talk. You might be puffing a little bit, but you can still talk in full sentences while you're exercising. So that test is applicable whether you're someone who's never exercised or whether you're an elite athlete. You'll be able to exercise at your level and still be able to talk. One of the other questions we often get asked is when we're doing any other sort of exercise like Pilates or weight training or any of the other sorts of exercises you might do, are there any particular modifications that you might make? One of them is with regards to positioning. So are you able to lie flat on your back when you exercise? At Fitwise we recommend that you don't choose to exercise lying flat on your back. And the reason for this is that it can compromise your blood pressure and your blood supply to the uterus, and for that reason we encourage you to choose other positions to exercise in. There are lots of ways to modify exercise and still get great effect of the exercise that you're doing without having to lie on your back, and physios are able to give you advice regarding how to do that. One of the areas that's under a lot of strain during your pregnancy are your pelvic floor muscles. So when you are exercising, you need to be mindful of your pelvic floor and what your pelvic floor is actually able to cope with. So lifting heavy weights is not recommended during pregnancy if your pelvic floor isn't able to cope with it. How can you tell if your pelvic floor is able to cope with it? If you are leaking during exercise, your pelvic floor is not coping. If you find that you feel heaviness or a bulge within the vagina while you're exercising, your pelvic floor is not coping. And if you find that having exercised, you feel tired, achy or heavy around your pelvic floor area, so that's the area that runs between your pubic bone at the front and your tailbone at the back and goes across underneath, if that area actually feels heavy or achy after exercise, then your pelvic floor is not coping. And once again, your pelvic floor physiotherapists are able to give you advice on how to modify exercise in a way that isn't putting too much impact on your pelvic floor, and also how to help your pelvic floor to be able to cope with the exercise that you're doing.